Thanks, Neil. Gosh, that's a really tough presentation to now follow. So thanks for that, Sarah, and I'll do my best. Hi, everyone. I'm Chloe, and I lead on our research and engagement programme. And today I'll be focusing on research in relation to key issues within primary care and the cross-cutting themes that we've identified through these pieces of research. So in partnership with our colleagues at Healthwatch Essex, we have been commissioned by the Hertfordshire and West Essex Integrated Care Board to undertake a series of engagement projects in relation to primary care. And ultimately, the aim of this engagement is to improve areas within primary care through sharing the lived experience of Hertfordshire residents, but also by making recommendations to the primary care transformation group. And our reports and recommendations are also shared much more widely than that across the system, so that key learnings and best practice can be adopted. So there's some examples here of the research that has been undertaken. So you'll see there are some in relation to GP services where we engage with autistic adults, people with learning disabilities and carers. We also had a focus on women's health, speaking about the menopause and cervical screenings. And we also had a focus on long-term conditions, so looking at cardiovascular disease, type 2 diabetes, and views on community pharmacies. And through this research, we have heard from over 2,300 Hertfordshire residents. Next slide, please, Lauren. Thank you. So despite the varying topics and groups that we've spoken to, Hertfordshire residents often experience quite similar themes, and I've listed these here. So kind and respectful and compassionate healthcare professionals, some excellent examples of personalised and individualised care. There's also been areas for improvement, such as poor communication, inconsistency in the delivery of care, lack of health and wellbeing support, the need for more training and education, lack of flexibility and choice in making and booking appointments, the lack of implementation of reasonable adjustments and accessible information, and the need to record and register individuals. Next slide, please. So we'll start with the positives then. Across the engagement, positively, most respondents said that healthcare professionals were kind and supportive and reassuring and compassionate. So some carers described the care they received from their GP practice as good or very good, and they emphasised that they are kind and understanding of their caring responsibilities and the impact that has, and supportive in offering practical and emotional care. Other examples include people with learning disabilities commented that most clinicians are kind and patient and take the time to listen to them. And some women who had been through the menopause said healthcare professionals treated them with kindness and understood and took the time to listen to their concerns, providing them with the information, support and reassurance they needed. Women who had cervical screening often said the care they received was either good or very good, commenting that healthcare professionals were kind and reassuring and treated them with respect. We also found that many autistic adults received good support from their GP practice, again emphasising that clinicians were friendly, patient and understanding. In terms of personalised care then, again, we saw some really excellent examples of personalised care from primary care services. So for example, some people with learning disabilities had a care coordinator at their GP practice who supports them in making appointments to alleviate the difficulties of them having to contact their GP practice. And many said that that support was invaluable to them and enabled them to get the treatment they needed. Other people with learning disabilities also said that their GP practice was accommodating of their needs and preferences, such as letting them see the same clinician, booking face-to-face appointments and providing home visits. We also found that some women who were going through the menopause received personalised care from clinicians who gave them the information about the various treatment options they could have and really made them to be empowered to have control of their health. We also found that some women who received a cervical screening said that healthcare professionals were accommodating of their needs, such as providing a chaperone or allowing them to bring a friend, family member or partner and having a longer appointment to help them feel comfortable. And likewise, some autistic adults receive personalised care, such as being given longer appointments, being able to wait in a quiet or private space and able to see the clinician of their choice and accommodating their communication needs. So in terms of barriers then, lack of flexibility was a key issue for respondents. So many people said that they experience troubles accessing their GP practice, which I'm sure many of us can relate to, such as lack of available appointments, long waiting times for appointments, challenges getting through to their GP practice. But what is really important to recognise here is that was even more challenging for the groups that we engaged with. So certain examples here, many carers said it's difficult to make appointments and they often struggle to contact that GP at the typical 8 AM slot due to their caring responsibilities. Likewise, people with learning disabilities often struggle to contact their GP practice, and most of them needed the assistance of their carer or support worker. However, their carer and support worker often wasn't with them when they could contact their GP due to the strict hours in which they could contact. And that was a significant barrier to them and often made them quite reluctant to contact their GP despite needing help. And over 50% of autistic adults face challenges with making an appointment, with many of them finding the processing highly distressing for them. Lack of choice was another key issue, with many saying they had no choice in the type of appointment they could have, as well as the clinician they saw. For example, 76% of carers said they weren't offered flexibility when booking an appointment, even if they were registered as a carer with their GP practice, and were also given no choice in the type of appointment offered. Often people with learning disabilities weren't given a choice in the type of appointment they wanted, despite many finding it difficult to have a video or telephone appointment, and were also not able to choose the time and date of their appointment, meaning that they couldn't have their carer or support worker to be available to accompany them. And they were also often not given the choice to see the same clinician, which is so important for people with learning disabilities in building that trust and rapport. And likewise, there were similar experiences for autistic adults who found contacting their GP practice by telephone very distressing. However, for many, that's the only way they could contact their GP practice. They couldn't go in, they couldn't use an online system, so they had no choice. And for many, that made them very reluctant or even made them avoid accessing their GP due to the level of stress it would cause. And they also were often not given a choice in the clinician they saw, despite feeling far more comfortable to have a consistent GP to build a relationship with. So reasonable adjustments was a key issue, and under the Equality Act, Health and Care must implement reasonable adjustments to help people to access the care they need. However, we found that many people weren't informed about reasonable adjustments that they were entitled to, or did not have these implemented despite it being on their patient records. So, for example, many autistic adults and people with learning disabilities face barriers when visiting their GP practice, and these barriers often weren't addressed. And we even found that 66% of autistic adults weren't aware they could request any reasonable adjustments, and 70% had never been offered any reasonable adjustments. So for many, that meant they weren't visiting their GP practice because the experience was too distressing. And likewise, under the accessible information standards, NHS organisations must identify, flag and meet the communication needs of patients, and that includes providing information in large print or braille or easy read. However, we found when speaking to people with learning disabilities and autistic adults that many of them weren't given information in the way they needed, and were even asked in some cases what easy read even was. Next slide, please. Thank you. So linked to this, a number of respondents said they received poor communication from primary care services and weren't communicated in a way that was appropriate for them. So, for example, people with learning disabilities and autistic adults often weren't communicated in an accessible way. And clinicians would use complex language and terminology which was difficult for them to understand. They sometimes would also speak to their support worker or carer instead of them, which they found disempowering and dismissive. And for autistic adults, some clinicians didn't understand that they can become very anxious and sometimes non-verbal or have difficulties communicating their needs. And again, these would often be barriers preventing people from getting the support they need. So registration and recording was another big issue across primary care. So for example, we found that 68% of carers are formally registered as a carer, but many people didn't know that they could register as a carer with their GP practice and didn't know what benefits that would give them or why that was important. And many felt it would just make no difference to the support they would receive from their GP practice. And likewise, 64% of autistic adults said their GP practice knows they're autistic, but again, many said that that didn't improve their experience of accessing their GP. So for example, as I mentioned, reasonable adjustments weren't implemented despite that being on their patient records. And some people with learning disabilities share that clinicians have at times questioned whether they have a learning disability, which they found very inappropriate. So across the engagement, respondents emphasised that the quality of care they received was very much dependent on the clinician they saw, and highlighted an inconsistency in the standard of care and support offered. So for example, women going through the menopause had to speak to healthcare professionals multiple times about their symptoms and were often misdiagnosed and not listened to. They felt their concerns were dismissed and not taken seriously until they finally spoke to a clinician who took the time to listen and understand. Likewise, for those who had cervical screenings, there was a mixture of positive and negative experiences, and that was largely dependent on the clinician who was conducting the screening. And some people with learning disabilities and autistic adults shared that the quality of care they received was also dependent on the clinician they spoke to, with some being very accommodating and understanding of their needs, while others were quite dismissive. Next slide, please. So we know that some groups should receive additional health and wellbeing support, given the health inequalities they are likely to face. However, for carers, we found that although they should be entitled to support, such as being offered an NHS health check and offered a carer assessment, most people weren't receiving this, and over 70% weren't aware that they could access that type of support. They also were not given any signposting information, and only 12% were referred to a social prescriber. They also hadn't had their physical or mental health examined in relation to their caring role, and many felt that GPs weren't proactive in asking about how their caring role is impacting their health and well-being. In comparison, people with learning disabilities were often well supported by clinicians and living a healthy lifestyle. However, the gap there was that they often weren't given that practical information on how they can implement the advice they were given. There was often poor quality annual health checks and health action plans carried out. And for autistic adults, research has consistently shown that autistic people are far more likely to experience mental health problems. So it's crucial that clinicians are responsive to this. However, our engagement with autistic adults found that only 32% said the GP had discussed their mental health with them, and often the support they received was either inadequate or inappropriate. So unsurprisingly then, the majority of people said that there needs to be more training, awareness and education, and that was a key recommendation made throughout our report and by people from their own lived experience. They felt that healthcare professionals needed much greater training and education to improve their understanding of individual needs and to improve the delivery of care. So very positively then, as I mentioned, in each of our reports, we have made numerous recommendations to improve the quality of care delivered to patients. And I'm really pleased to say that the Primary Care Transformation Group and the wider system has been very proactive in making positive changes and addressing the recommendations we made in our report. I put on a few examples on this slide. So for carers, primary care has committed to ensuring that each practice has a carer champion and identifying carers and recording this on patient records, and also are committed to ensuring carers are offered health checks and signposted to social prescribers. For autistic adults, Hertfordshire County Council and the Mental Health, Learning Disability and Autism Health and Care Partnership has been proactive in using our findings to inform their work streams. And primary care has also been trialling autism health checks and introducing digital flags on patient records to note reasonable adjustments. And for people with learning disabilities, primary care has been piloting care coordinators across the system and looking to improve annual health checks and the quality of health action plans, and have also been improving knowledge of reasonable adjustments and providing more training for staff. And for cervical screenings and the menopause, a selection of GP practices have set up group sessions to support women. And they have also developed new toolkits for GP practices to make sure cervical screenings are better for women. And 11 primary care networks have received funding to look at new ideas for promoting cervical screenings. So for me, the overarching theme across all of these sub-themes, and I think that Sarah put it brilliantly, is it highlights the importance of listening to patients and providing that personalised care, that no patient's the same and our experiences and needs vary, and that needs to be appropriately accommodated for. But this is even more essential for our groups and communities who tend to face greater challenges and health inequalities. So thank you for listening, and I'm very happy to take any comments or questions.
Thank you so much, Chloe, for pulling all those things out so powerfully. I thought that was a good example of how we use those knitting needles that Sarah was talking about. So are there any questions for Chloe? Kevin?
Yeah, thanks. Just last Wednesday it was actually a gentleman from Essex sort of shared who's got has diversity understanding, said I had no trouble with the clinician. He treated me just as I think anybody else would, with its reception. It's actually getting through there. And sorry. So I was saying that I had an anecdote that emphasised what this information here is that the clinicians generally were very good. You got exactly the same treatment you would have expected that anybody would get, but it's actually the receptionist and getting through that. And the question is that with the 5-year GP Forward View, which was a few years ago now, there was training given to receptionists, free training provided to all our GP surgeries. Be interested to know how many took it up, how we managed to get the receptionists, and of course, 10 years later or 5 years later, there's a fair chance there's been a lot of change there. But it would be nice to know how effective that training was. And I tried to find it the other day, I couldn't find it because somebody was asking for it. I couldn't find it.
A lot of our recommendations did include training for all healthcare professionals, so including reception staff. As you were saying, Kevin, in our engagement with autistic adults in particular, they did struggle quite a lot with the reception staff, and again, really highlighted the inconsistency where some reception staff would be brilliant and really attentive and look at their notes and make sure any reasonable adjustments they needed were implemented, whereas others didn't provide that quality of care. So I think training for reception staff is important alongside for clinicians as well.
Sorry, can I also say there is a field on the GP record that is for reasonable adjustments or communication preferences. Be interesting to know how many are filled and how many match those needs.
Absolutely.
Question? What should we do? With that last question.
Okay, there is a field on the GP record, on your medical record, that is actually for them to place reasonable adjustments and communication preferences. Be really interesting to know, maybe through Open Safely, it's a big project, to actually find out how many have been filled in and does it match those people that have, say, autism or not, because I can almost guarantee that anybody with autism needs reasonable adjustments and probably needs communication preferences. So, so it'd be interesting to study.
So I'm just thinking aloud from the amazing work last year in Cost of Living, where Joe did this wonderful 2-pager and tying in with the nursing officer. If we focused on autism and where it's a bit like friendliness, neurodiversity, and get the whole system to focus on that because the work's so good and powerful, I don't think it would take that long to see the change, the knitting happening. Because we know with carers, if carers are flagged on the GP record with reasonable adjustment, the receptionists do know about that. But I think a lot of it's about lack of empathy, people not understanding, not knowing it themselves, how to deal with neurodiversity.
Yeah.
So I just think there's a potential next step that will bring a lot of those things together.
Yeah, I think that's an excellent suggestion. Thank you.
I can't see any more hands, so thank you very much, Chloe.